Hi, and welcome to a special edition video lesson for our benchmark on the cardiovascular system. Now, usually when we're in class, I have a special guest speaker from our local Mid-Michigan Health paramedic team. And this year I had hoped to get in touch with him to do a quick lesson on hands-only CPR, but unfortunately our schedules just didn't work out. So I'm here today to talk to you about the American Heart Association's recommendation for hands-only CPR. In the old days, when someone was non-responsive and in cardiac arrest, we were taught to do rescue breathing, which is to give 2 breaths and then resume compressions or pushing hard on the chest. New studies have actually shown that stopping compressions to rescue breathe for someone is one of the worst things you can do. It causes a sudden drop in blood pressure, and the response rate is very, very low. So for those of you who don't know this, I've been a volunteer firefighter since 2007 for the Beaverton Fire Department, and I do have my medical first responder license, and I do renew my CPR certificate every couple of years. So this is something that I've been taught many, many times, and as a school employee, I can see the benefit of mass education of both students and school personnel, because really anyone at any time can go into cardiac arrest. So hands-only CPR is really 2 simple steps. If someone is non-responsive, you need to call 911 first. And step 2 is to start CPR. And we're going to talk a little bit about how to do CPR, and I'm going to direct you to these videos here below to help you understand more about what hands-only CPR is and how to use an AED. And if you're not familiar with the location of an AED in either wherever you work or in your school, it's good to know. So for my Meridian Junior High students, our AED is located in the main office. So let's talk, let me go back a couple slides, about what a heart attack is versus cardiac arrest. So a lot of people confuse the two. They think cardiac arrest and heart attack are the same thing, and they are not. Now, a heart attack can certainly lead to cardiac arrest, but they are not the same thing. So outside of the heart, there are many major blood vessels, and these are different than the blood vessels that connect to the lungs. It's a little different than the pulmonary cardiac loops that we've been talking about. These are blood vessels that are specifically there to provide blood to the heart muscle. And the muscle is constantly contracting and needs oxygen just like any other part of the body. And so we have some very large blood vessels on the outside of the heart. So these are called coronary arteries. All right. If someone has blockage of one of these arteries, and sometimes this is caused by buildup of cholesterol in the arteries, in the walls, you can see it here. Sometimes people have issues where their blood clots or get stuck in one of these narrowing of the blood vessels. The heart is now starved of oxygen, and the heart is really, really struggling to continue to pump because it never stops without this supply of oxygen-rich blood. So if one of these arteries becomes clogged, the heart tissue around it can start to die. And as that muscle weakens and starts to die, it can cause an irregular heartbeat. And in a very worst case scenario, the heart can actually stop pumping. So what do they do to treat people who are having a heart attack? They usually send them to a department in the hospital called the cath lab, which is short for catheter, and they can send basically the equivalent of a long grabber hook, for lack of a medical term. They can go in here and scrape this out, and they can actually put in what's called a stent to hold this blood vessel open and to help blood flow. So heart attacks are very, very, very dangerous. They can cause a lot of discomfort and pain, and sometimes they're silent. People don't know that they're having them. Luckily, if they're caught in time, they can be fixed and people's hearts can go back to normal function. So what is cardiac arrest? This is an emergency. This is when the heart stops pumping. A lot of times it can be due to a heart attack, but sometimes there are underlying issues in people's hearts that simply cause them to stop pumping. Our heart is regulated by an electrical system, and sometimes that electrical system just defaults and it stops. And if this electrical impulse is interrupted, the heart can start beating irregularly and then eventually stop altogether. So, if you think someone is in cardiac arrest, you should always activate the 911 system first. Then you can check for breathing and you can check for chest rise, but don't wait. If someone's unresponsive, start CPR immediately and don't stop. There are some best practices for CPR, for instance, where to place your hands and how frequently to push down on the chest. And a lot of those are covered in the videos linked earlier in the slides. Generally speaking, you need to push down on the person's chest 100 times a minute. So that's a lot. And usually someone who's doing really good CPR is tired after about 2 minutes. And for people like me on an emergency scene through a fire department or working with the paramedics and the ambulance, we want to rotate people out who are doing active CPR, because if you're not doing effective CPR, you risk not being able to save someone's life. These videos that are linked here, one is from the American Heart Association, and this series is actually from a pilot program in Washington State, which was one of the first widespread educational programs to get everyone, every adult and child in school, certified and trained in hands-only CPR. And a lot of research came out that they had a great recovery rate of people who are in cardiac arrest, and they were finding that just doing hands-only CPR saved a life. So I really encourage you to watch some of these videos, familiarize yourself with the procedures and the processes, and I would love to tell you more if you have any questions at this week's Zoom about how you can do effective CPR. All right, so my next cool video is going to be the dissection of the pig heart, so stay tuned for that coming up next.